Good afternoon. Welcome to OHC Cancer Conversations. My name is Joni Monzo, and I'm thrilled to have Dr. Abigail Tremelling with us today. Welcome, Dr. Tremelling.
Thank you.
As many of you know, October is Breast Cancer Awareness Month, and Dr. Tremelling is one of our surgical breast oncologists, OHC, so I think we'll get started with some of the questions that we often hear from our listening audience as well as from our patients. First of all, tell our viewers, what is a breast surgical oncologist?
So a breast surgical oncologist is a surgeon who specializes in breast cancer surgery or breast surgery in general. We have specialized training through a fellowship program where we can treat both benign and malignant diseases. We often work with plastic surgery as well to do specialized reconstructive techniques. We are also trained in special hidden scar techniques and nipple sparing mastectomies as well.
Great. And besides just treating breast cancer, you have a lot of other conditions that you treat. Can you just give a general overview to our viewers, what sort of patients you see or other things that you treat for?
Sure. We have training in genetics and high risk as well as benign and malignant breast diseases. So we treat both men and women if they're diagnosed with cancer of the breast. We do manage women who are at high risk for breast cancer on what screenings they should have and what they should do for prevention and risk reduction, and then other non-malignant diseases within the breast that often need or sometimes might need surgery we treat as well.
So let's get into the importance of screening, and you and I were chatting prior to going live, and we've recently interviewed two of our patients who actually found their lesion by self-exam. So let's first talk about when should a woman start self-exam, and then when should they start screening with mammography?
I recommend start your self-breast exam once you're an adult female, so probably mid-20s is a good age to start, and that's really just to be aware of your own body. Oftentimes women can pick up on something that happens or is discovered in between normal testing. That's the biggest thing, is to know your body, tell someone if you feel something abnormal. And then in terms of screening, we recommend all women start at age 40 with an annual, once a year screening mammogram. And if you're high risk, which is something you can talk to your doctor about, then we sometimes recommend either starting earlier or do more than just a once a year mammogram.
And I know a question that has been asked, should women do self-breast exam the same time of the month?
Yes, so typically we say once a month, about a week after you start your period is a good way to remember. And if you're not having menstrual cycles regularly, then just once a month is good.
And I've also talked to some of our patients who said they've been in the shower. So during a shower, you can do a self-breast exam, also look in the mirror.
Yeah, the easiest time is often in the shower because it's just easier for your hand to glide over the breast with that smooth, the water. Sometimes you can apply lotion in bed or something like that as well. And then checking the whole area of the breast underneath the arm as well, where we have lymph nodes. And then also, yes, looking in the mirror to make sure you don't have any changes to the texture of the skin. And you can do that just looking straight at the mirror, raising your arms up, or putting your arms on your hips.
Okay, good advice. So let's talk about symptoms, because sometimes it's found on mammography. What are the classic or most typical symptoms you see in a patient?
Most common symptom is no symptom at all. Most women just find their breast cancer because they had their screening mammogram, and hopefully it was caught early if they've been up to date, and it can be caught small and when it's most easily treated. The next most common symptom would be a lump in the breast, sometimes a lump under the armpit. There can also be some changes with the skin of the breast or the nipple of the breast, so redness, crusting of the nipple, scabbing, anything like that, or like an indentation or an inversion of the nipple can be seen as well. Okay. Sometimes nipple discharge as well.
And what about for men?
So men, it would be most commonly feeling a lump or any of those skin changes as well.
Okay. And then you'd mentioned about genetics, so, and women who are at high risk. So what would be reason for someone to call OHC, because we obviously do genetic testing and patients do not have to be an existing patient of OHC, but what are those risk factors and how does genetics play into breast cancer?
The biggest risk factor is if you have a significant family history of breast cancer, and that's just not in a first-degree relative like a mom or a sister, but it could be in an aunt or cousin or grandmother. Anytime there's more than one person in the family that was diagnosed with breast cancer, or someone who was diagnosed at a very young age, that's what alerts us that there could be a genetic cause. Other things that increase a woman's risk are when they started their period, when they went through menopause, their breast density. Those are other things that can play a role into just general risk, not genetics, but general risk.
And then we've also, talking about risks, just lifestyle changes. So what are things that our viewers should know about, or things that they can try to remove or reduce that puts them at risk?
Right. Some easy things, not easy always, but some things we can do to adjust our risk is maintaining a healthy lifestyle, exercising up to 5 times a week for about 30 minutes, eating a healthy diet, anything that's heart healthy recommended. It helps reduce our risk of cancer as well. Not smoking, as that increases our risk of breast and other cancers, and then limiting our alcohol consumption to about 2 to 3 drinks a week actually reduces our risk.
Yeah, and we hear that across the board with all cancers.
Right.
Yeah, absolutely. So someone feels something unusual, they have some concerns. What are the next steps? Who should someone call? Should they call their family doctor, their OBGYN, breast surgeon? How does that process work?
Really, they can call any of those people. The biggest thing is just call someone. Then typically we start out with some sort of breast imaging, an exam, depending on if you're seeing the doctor at the same time or not as well. And then after that, typically we just walk you through the rest of the process. If you need a biopsy, we'll walk you through what that entails. But any of those people you can call, just let anyone know if you feel something abnormal.
And here at OHC, there really is a team effort, and obviously communicating with the primary care physician or the OBGYN. But when a patient does come to OHC, what other services do you include or offer within the multidisciplinary approach?
We do have a multidisciplinary approach where oftentimes we meet with a breast surgeon first, but then we work very closely with the medical oncologists, radiation oncologists, genetic specialists, plastic surgeons if reconstructive procedure is needed. We work closely with radiology and pathology just to make sure that everyone who is involved in diagnosing or treating breast cancer we've spoken to, and make sure we have the best plan and most up-to-date plan for the best outcome.
Right, and our approach truly is personalized because
Absolutely.
everyone's cancer is unique. So besides surgical, when you mentioned medical oncology, I think one of the things OHC is very much well known for is their clinical trials program. And so we always have ongoing clinical trials around breast cancer.
Yes, absolutely. There's always at least a few trials, mostly from a medical oncology standpoint, where we're developing or getting new medications, especially immunotherapy is a big one right now, that are available to patients that might not otherwise if they're not eligible for a trial.
Yeah, that's great to know. One of the things that I did want to mention, because you presented at a wonderful community event a couple weekends ago, Faith Ministry, there are certain groups that are at higher risk for breast cancer. Could you speak about Black women and their risk for cancer, breast cancer?
Yeah, so there are different risks throughout different ethnicities and races. Black women do have a higher risk, not just of being diagnosed with breast cancer at a younger age, but also of an aggressive type of breast cancer called triple negative breast cancer. They're more prone to developing that as well.
So I think just reminding women, what you said before, is to be their own advocates, to start screening when either if they're high risk or when it's recommended, but also alerting anyone of any changes is really imperative, because that's early detection is better outcome.
Absolutely.
Yeah, great. Well, super. Well, listen, thank you so much, Dr. Tremelling. We appreciate it. For our viewers, if you'd like to learn more about OHC, Dr. Tremelling, our cancer genetics program, or our clinical trials, please visit us at ohcare.com or call 888-649-4800. Thank you. This has been really helpful. And